Today we'll be looking at the MiniBand series for hip activation. We'll start with our client having two MiniBands, one placed above the knees and one around the level of the ankles. We will then have the client assume a position with feet shoulder width apart, toes straight forward, and a slight knee bend. The first movement we'll be looking at is the lateral walk. From here, our patient will move one foot forward and follow that with the other, keeping tension on the band from both ends. Big things that we're looking for are for the knees to remain in position aligned over the feet and for no femoral adduction or internal rotation to occur, leading to a valgus position. The second movement that we'll be looking at is the skater. From here, the patient will assume the same base position. She will unweight one of her feet and reach it backwards in a diagonal fashion, keeping the foot unweighted the entire time. The other key here is that the stance knee does not drop in. Again, looking for that femoral internal rotation and adduction. That's what we don't want to see. So she needs to maintain that lower extremity position throughout the movement. The third movement that we'll be looking at is the stagger linear walk. From here, the patient will position one foot in a stagger position forward with the other foot slightly backwards. We will instruct her to maintain tension on the band the entire time so that the knees do not drop in inside the midline of the foot. So maintaining that tension, she will then step laterally with one foot, followed by the other, maintaining tension on the band from both ends and avoiding that femoral adduction internal rotation. We can then have her pause here, and we'll move into our fourth movement, where we maintain the staggered position but move forward and backward. So we'll have our patient step forward from this position, maintaining tension on the bands the entire time, and not allowing those knees to drop within the midline of the foot. We'll then have our patient pause, stand for a moment to recollect her strength here. She's been doing a lot of steps, and we'll go into the fire hydrant. So from here, she's going to place her feet closer together than shoulder width, about hip width apart, maintaining slight tension on the bands. She'll then unweight one foot and lift it in a diagonal and posterior direction, externally rotating the hip. With this, we're not only looking to see that the patient is able to maintain an upright trunk without excessive shift, but also that the stance limb does not drop into that internally rotated position. And finally, we are going to take a look at the tiptoe from this position. So here the patient will assume the base position, go up on her toes with arms overhead, and take steps laterally, maintaining the position on the toes and maintaining knees over the center or midline of the foot.